Welcome to the Health on Track podcast. Let's talk well-being.
Welcome to the Health on Track podcast, offering you a shot of wellness. I'm Yasmin, and I'm the Member Engagement and Communications Manager at GIG Gulf Insurance. Diabetes affects approximately 1 in 10 people, out of which about 90% is type 2 diabetes. In this episode, we'll discuss the risk factors that can result in diabetes and what you can do to avoid it. We are here today with Dr. Ali Aldibbiat, consultant endocrinologist and associate professor of endocrinology from Mediclinic City Hospital, Dubai. He has over 23 years of clinical experience in different healthcare settings in the UK and Middle East. He has special interest in obesity management and application of technology in the management of diabetes, including insulin pumps and closed-loop systems. Dr. Ali is a strong believer in patient-centered care and that patients and doctors are partners in this journey. Thank you for taking the time, Dr. Ali, to join us today.
Thank you very much for having me. Thank you.
So, of course, everyone knows diabetes, but can you just give us a more proper definition of the diabetes and the difference between type 1 and type 2?
Certainly. Diabetes is, in practice, a rise in sugar when it's not supposed to be. So our sugar is always tightly controlled within certain limits. And when it exceeds that limit with no good reason, then continuously, then that is diabetes. And that can happen in a few occasions. As you said, type 2 diabetes, when the body is producing insulin, but that insulin is not effective. So the sugar is rising more after food, and the body inside is producing more sugar. And insulin itself, there is some resistance against it. With type 1 diabetes, which is an autoimmune disease, there is a rise in sugar because insulin production inside the body is lost because the immune system attacks the pancreas, specifically the cells which produce insulin, and destroys them. And that results in complete loss of inside insulin. Because of that, sugar goes high. There are some other types of diabetes, like gestational diabetes. That happens in pregnancy when the pregnancy-related hormones are increased and cause a degree of insulin resistance. Some ladies' bodies can't tolerate those, and that results in a rise in blood sugar. That is usually temporary for the duration of pregnancy. That is called gestational diabetes. There are some other types of diabetes that are not that common, like the genetic diabetes or the diabetes related to cystic fibrosis, or the ones that related to the inflammation of the pancreas, pancreatitis.
Okay. So what causes type 2 diabetes?
So as I've mentioned, there are few contributing factors to type 2 diabetes. One of them is insulin resistance, and this usually comes in because of excess weight. When we have excess fat tissue in our body, then the insulin finds it difficult to open the lock of the cells and allow sugar to get inside, and that results in sugar going high. Then the pancreas needs to produce more and more insulin. And also, sometimes the liver and the muscles become resistant. They don't see insulin properly, and therefore the take of glucose from periphery becomes low. Sometimes beta cells are weak. They are not able to keep up with the demand of the body. Sometimes it's related with dysregulation of our appetite. In general, you find obesity contributing to a lot of the factors there. But, and there is an intimate relationship between weight and risk of type 2 diabetes. Obviously, there is a bit of genetics as well. So if there is family risk of diabetes, then you see more of that in the family, in the offspring, in the children.
Okay. So what are some early warning signs that people should be on the lookout for?
So in general, for type 1 diabetes, it's to do with weight loss. You see weight loss and unexplained weight loss. But in general, when sugar is high, you start to feel hungry, despite that the sugar is high, because it's not entering the cells. You may feel lethargic. If you happen to have a wound, it may be difficult for the wound to heal. Also, some patients may have, in addition of the excess hunger and lethargy, they may start to have increase in weight. In extreme cases, like when it is too advanced, you see changes in the eyes, you see excessive thirst, you drink a lot of water, and you pass a lot of urine. We call those, increase in thirst and urination. That can be a sign of diabetes as well.
Okay. In your experience, do you find that certain genders or age groups are more prone to getting diabetes?
There is some science to that, yes. Although the scene has been changing significantly, but classically, type 1 diabetes happens in the younger ages, the autoimmune diabetes, when the immune system attacks the pancreas and result in destruction in beta cells. Now, in type 2 diabetes, historically also, it used to happen in older ages when we had, in the 40s or 50s and even 60s or 70s with excess weight. We started to see more type 2 diabetes happening at a younger age. And we've seen adolescents having type 2 diabetes with the excess of obesity that's happening nowadays. And at the same time, we see in the family, like if someone has type 1 diabetes in the parents, the children are more likely to be type 1 diabetes in the males than females. But in general, there is no clear kind of gender bias as much as incidence of diabetes has been increasing significantly.
Why do you think that is?
It's interesting. I think if we look at the incidence of type 1 and type 2 diabetes, both are increasing. And we know that type 2 diabetes is related to obesity, and obesity rates have been increasing significantly over the past years. And there are many theories and research about it to do with the modernity, the lifestyle we hold, also to do with the processed, highly processed foods, lack of exercise. Also, genetics play a major role to it. And I usually tease my patients and tell them, like, if you have obesity, this is related to survival genes. Our ancestors used to have famines. Thankfully, these don't happen anymore. But when famines used to hit, people who were not able to store fat in their system used to die away. And those who survived, we are their offspring. So these are survival genes, but now because we live in a time of plenty, so everything is available and exercise is less than otherwise, then the rate of obesity is increasing, and with that, the rate of diabetes as well. But also type 1 diabetes has been increasing, although it is related to autoimmunity. And there are theories behind it to do with some viral illnesses causing a trigger in the immune system in those who are having predisposition to diabetes and resulting in development of type 1 diabetes.
So you mentioned genetics more than once. So does that mean that if anyone has a family history of diabetes, then they're definitely getting diabetes, or?
Interesting. The answer to that is no, but the risk is high. So if we take type 1 diabetes, if the father has type 1 diabetes, then the children have almost 10% chance of getting diabetes. If the mother have type 1 diabetes, the children almost have 3 to 4% of getting diabetes. But if both parents have type 1 diabetes, even with that, children's risk of type 1 diabetes is 30%. So it's not everyone. Type 2 diabetes, however, the risk is higher. So if the father has type 1 diabetes, the risk in the children is about 30 to 40%. If the mother has it, the risk is 30% or thereabouts. But if both parents are having it, it's over 70%. Again, it's not everyone. So if you look after yourself, if you lead a healthy life, does not mean that you will get diabetes, but the risk is there certainly. And it's important to comprehend that and keep that in mind.
So can diabetes be kind of reversed if it's early enough?
It's a very good question, and the answer to that is yes. But that is particularly in type 2 diabetes. We know from really amazing research that happened in the field of type 2 diabetes that early on, if we reduce weight enough, then we could reverse diabetes and patients could go back to normal weight. There's a famous trial done by Professor Roy Taylor and Mark Lean in the UK, where they took patients who developed diabetes within 6 years and they gave them restricted diet, 800 calories a day. It's not easy, but those who lost weight lost diabetes. So those who lost 15% of their weight, 83% of them lost diabetes completely. They normalized their sugar, which is a powerful thing to have. Similar data we had in patients who had bariatric surgery, the weight loss surgery that resulted in them losing enough weight. And nowadays, we're having many patients achieving that with the weight reduction treatments that we're having, the injections that we're having. So it's to do with weight loss in general. In type 1 diabetes, however, we have innovative treatments that are soon to come to Emirates, and they are licensed elsewhere in the world, which can delay the onset of diabetes. So if we know that the person has autoantibodies, those antibodies that indicate that the immune system is attacking the pancreas, but not yet in diabetes range, if they receive certain treatment, we could delay diabetes for a few years, 3 to 4 years. And more research is happening in this field. And really, it's insightful that in the future, we will have powerful treatments that could delay diabetes even more or hopefully stop it in its tracks.
Hopefully. So in those cases that they were able to reverse diabetes, that was like diagnosed type 2 diabetes, or they were still pre-diabetic?
No, diagnosed type 2 diabetes. On the average in that trial, it was 6 years. But we had patients like, and me and my colleagues, I think the oldest patient with diabetes who reversed was 15 years of diabetes.
Wow.
Not everyone can achieve it, but if the right care is done, if lifestyle is modified, and if the patient is motivated, they have a good chance. It's not 100%, but they have a good chance to reverse diabetes and maintain health.
Okay, so let's talk a bit about the pre-diabetes. What can people do in that phase to like not get there?
So we need to look at the risk factors for diabetes. If someone is developing pre-diabetes and they started to show signs of diabetes, that means there's something in their environment and their lifestyle that is driving them into that kind of line. And if we address those points, we could potentially reverse them back to normal glucose regulation. And one of them is to do with diet. So in general, if we avoid highly purified carbohydrates, if we avoid processed foods, if we like the likes of junk food and fast food, and if we get closer to nature, closer to the fields, like brown bread instead of white bread, having normal balanced food based on vegetables and nuts and salads, and having good balance between the proteins, meat and chicken and fish, as well as exercise, we stand a good chance of reversing it. And, it can be regimented in a very good structured way. It can be a change in lifestyle and approach to life. But if we leave things as they are, once you hit prediabetes, that's a progressive track. You will definitely reach diabetes, maybe in 1, 2, or 5 years, but eventually you will reach diabetes.
So it's like a warning sign, like your body is giving you a warning or like an alert, like do something before you get there.
Correct. Absolutely. I call my patients, this is a golden opportunity to do something about it. We can reverse it before it becomes a reality. And it's a good motivator. No one would like to take medications for the rest of their lives.
Yeah. So after someone has been diagnosed with diabetes, how does this affect their lives on a daily basis?
So once you have diabetes, then you need to take really good care. We know diabetes can cause lots of complications, and the only way to prevent and reduce those complications by maintaining a good balance of diabetes and life. So they need to modify their diet, they need to integrate exercise as a routine part of their life. It's not an episode that we do and forget about. Also, we need to monitor our sugar. We need to monitor how are we doing from that respect. In addition to that, try to avoid any unhealthy habits, the likes of smoking, excess alcohol, any excessive staying up at night, those kind of things that, and those that drive stress up, we need to avoid them because we know that they are harmful. At the same time, we look at other kind of aspects of health, likes of high blood pressure. If it is there, we certainly need to address it. If there is high cholesterol, we certainly need to address it. In addition to following any medication advice that the doctor has given, taking the medication will enable us to get the benefit of from them. If we don't take them regularly, we don't get the maximum outcome from them.
So you speak a lot about diet and exercise, and obviously it goes without saying that this is like one of the most important factors that affect diabetes. But in your experience, did you find that there are other factors like stress maybe that like increase the risk of diabetes?
Certainly. I mean, stress, by the way, is good if we have a small dose of it, and this is part of life. But excessive stress for long periods of time lead us to burnout. This is certainly damaging. Not only damaging mentally, but also physically. When our adrenal gland is always activated, and we are in a state of stress, That results in weakening our immune system, weakening our defenses, and at the same time making decisions irrational with regard to food and lacking the willpower to do exercise. Certainly stress is a contributor, and maybe there is no magic bullet for this one, but it's an approach to life. If there are things that we cannot control, we cannot change, we should not dwell much on it. We can concentrate on the things that we can change. Any risk factors, any contributing factors that we can change in our life, then it's our obligation and duty to do it.
Yeah. You mentioned that diabetes can cause some complications. So what are these complications?
So it's a very important question, and this is what makes patients worried. You know, sugar is high in the blood in diabetes, and blood is all around the body. So basically, every part of our body could be affected by this high sugar. Our body is designed for a certain limit of sugar. If it goes below that, we don't feel well. If it goes beyond that, we don't feel well. So the common things that happen in diabetes when it is not well controlled is the damage to the eye, both to the back of the eye, to the lens. Patients could get early cataract. They could get what we call retinopathy when the retina is affected. Patients can get nephropathy when the kidney gets affected and becomes weak, and in some unfortunate cases result in kidney failure and dialysis and maybe needing a transplant. Could result in neuropathy, which is damage to the nerves in our body, especially the ones in the periphery, the likes of the feet and the hands, when we lose the sense of touch or pain. And some patients develop ulcers because of that. Also, it could result in effect on the big blood vessels, the likes of the ones around the heart and the legs and the brain, resulting in early dementia or strokes, heart attacks, or a clot in the legs. It can affect the other systems, like the mouth, the gum, the teeth. Basically, every part of our body could be affected. But the good news is, and this is based on robust clinical trials and clinical evidence, if we control diabetes well and if we control the risk factors well, we lead a nearly normal life, and those complications could be minimized to a really significant level.
So what is your advice to someone who has been newly diagnosed with diabetes to help them manage their condition?
Take it seriously. It's serious, but don't look at it as
Death sentence.
death sentence. Absolutely not. People with diabetes, type 1 and type 2 diabetes, can go on and live their life with fulfilling life. Yes, they need to take care of their diet. They need to take care of their life and take their medications. But the lifestyle that I advise my patients with diabetes to follow is really the healthy lifestyle we should all follow. So this is like, this is good stuff. It's not a negative thing. But also, taking medications when needed is important. It's sometimes the genetic trait is so strong in type 2 diabetes that even if we lose weight, we don't lose diabetes. We still need medications to control it, because we know if we control diabetes, we prevent complications. In type 1 diabetes, we need to monitor our sugar. We need to take insulin every time we eat. It's very important. If we don't, then complications arise. So take it seriously. Look at it as an opportunity to enhance your life and correct any unhealthy habits that you do have. But it's not a death sentence, certainly not. And you can go ahead, go along with your life and achieve everything you want to achieve.
Speaking of medications, are there like certain types of medications that everyone who is diabetic should be on, or is it just depending on their case? And can some of those people diagnosed with diabetes, is it possible for them to manage the conditions kind of just with the lifestyle changes without the medication?
So it depends on the type of diabetes. In type 1 diabetes, it's certainly insulin therapy. And there are different types of insulin, but the person with type 1 diabetes cannot survive without insulin therapy. So it's very important to take insulin. There are different types that are personalized to the patient's need. In type 2 diabetes, the story is different. There is something called personalized therapy. Every patient is different. We are really privileged now. We have many classes of medications, really effective, highly effective medications with extra benefits like protecting the heart, protecting the kidney, protecting the liver. Those medications, we choose them according to the need of the patient. And you are right, lifestyle is the baseline for any therapy we do. whatever the treatment is, no matter how powerful it is, if lifestyle is not good, it's not going to give benefit. And I've seen many patients managing their diabetes with lifestyle. If they do it well, it can be enough to correct things in some patients. So with monitoring, if we may be able to achieve normalizing of sugar with a healthy, effective lifestyle. In some cases, we need medication, and that is certainly personalized based on the patient's needs, patient's health characteristics, any pre-existing conditions, any risk factors in the family, and whether they have heart disease or not, whether they have kidney disease or not, whether they have obesity or not. So the treatment is, there's no one size fits all, but there are many options that we can choose from.
Okay. What are some misconceptions about diabetes that you would like to clarify?
There are few actually. One I would say, and we hear it a lot, doctor, my son or my daughter developed diabetes because they eat a lot of sugar. And especially wrong in type 1 diabetes. It's completely different. Type 1 diabetes is caused by the immune system attacking the pancreas. No matter what you eat, even if you are vegetarian, even if you don't touch carbohydrates at all, you could still get type 1 diabetes. So diet itself is not the main the cause for type 1 diabetes. And certainly in type 2 diabetes, if there is no predisposition in our system, even if the diet is not good, we may get other health problems, but not necessarily diabetes. So this is a general misconception. The other flip to it is, doctor, I can manage my diabetes with diet only. And this is a big mistake in type 1 diabetes. Even if sugar is normal, we still need insulin, otherwise ketones will increase and the person could eventually die. In type 2 diabetes, yes, we may be able to achieve good sugar control with diet alone, but not in everyone. And there is a good portion of patients who will still need support with medications.
Okay, that's great. My last question for the episode. Just looking ahead, you mentioned there are a lot of treatments and research that's being done. Is there something in particular that you're optimistic about?
Yes, there are a few exciting stuff that we will see over the coming few years. One of them is in insulin. Now we are going soon to have a once weekly insulin. One shot of insulin a week instead of few shots a day or one shot a day. Really exciting, and soon to come to Emirates. The second one is the technology. Technology has been making big breakthroughs, and one important breakthrough is this intelligent, smart insulin pumps, where the pump itself will talk to a sugar sensor and monitor the sugar in the body and give the insulin as much as the body needs. So automatically the insulin will be given to the patient without needing to inject and without needing to monitor sugar with a finger prick. This is available in some countries, and a simple version is available here, but more advanced versions are coming soon. In type 2 diabetes, we had really a revolution with the new therapies that help people lose weight, the likes of tirzepatide and semaglutide. Those are injections that are given weekly. But we are going to get more of those medications in the coming year. There is amazing research happening there, where some of those agents are going to become available as a tablet or as an injection what you take once weekly or once every 2 weeks, with extra benefits like protecting the liver or protecting the brain or protecting the heart or the kidney. Really exciting stuff coming.
That's great. Looking forward to it.
Absolutely.
Great. Thank you so much, Dr. Adi, for being here today.
Thank you, Yasmin, for having me. Thank you.
Thank you. To everyone listening, we hope you can take better care of your health now that you're armed with some more knowledge. In case you forgot, we're available on YouTube, video and music, Spotify, Apple Podcast, Anghami, and Amazon Music. Stay well and keep thriving.